I am Dr. Chandrika, working as an obstetrician and gynaecologist in Chirag Hospital, Bangalore, JP Nagar, second phase. I also do a visiting consultation at Malti Manipal Hospital, 9th block, Gynagar, Apollo Cradle Hospital, 5th block, Gynagar, and as also Motherhood Hospital, Banshankari, second stage. Well, this is a very nice question which has to be tackled by the doctors. See, morningsickness is pregnancy is a sickness which happens in all routine pregnancies. See, all the mothers already they are busy with their schedule and they are already working mothers, and when anything happens they do not tolerate it. So this morning sickness happens in most of the pregnancies. But there are some pregnancies in which cases mother will never know that she is pregnant. She will not have any effect of pregnancy at all. So one of the commonest thing is morning sickness. So in morning sickness, what is the thing is in pregnancy, in early pregnancy, when our body is getting adjusted to the pregnancy, what happens is there is some amount of acidity in the mother. So what happens when the mother is whole night she is fasting and she is asleep and she gets up in the morning. When she gets up in the morning, her stomach is empty. And when our stomach is empty, it is full of gastric acid. So when the gastric acid is there and it is empty, and all the more in case of pregnant ladies, because they are more hungry than the normal people. So this is the reason for morning sickness. So when she gets up in the morning, when she brushes her teeth, she has a tendency to vomit, and this is called as morning sickness. And nowadays what we have seen with change in the societal timetables and all, see so many mothers they are working in the nights and there is irregular working hours for the ladies. So morning sickness has shifted. So many people they get this sickness in the evening. So it depends on each patient. So morning sickness commonly is termed because it happens in the morning when she gets up. So that is nothing but early pregnancy vomiting. So how to tackle this morning sickness? As I have told you, it happens because the stomach is empty for a long time. So the best way of preventing this is just to put something into the empty stomach. When the empty stomach is boiling there with acid, just put something inside, put some substrate inside so that it becomes shant. So anything you eat, that is so many times in the middle of the night, those people feel hungry. So I will tell them to always eat something, keep something ready beside your bed. Because once if you have to eat and you have to go to the kitchen to prepare something, already you are not having proper sleep and you are also working ladies, I won't tell you to miss your sleep. So always if you have something ready beside your bed, just you can pop in something into your mouth and this morning sickness can be avoided. And even in spite of doing these procedures, in spite of that, if you get morning sickness, the doctor is always there and she'll give you some remedial medicines which prevents morning sickness. That is, we'll give you some antiemetics which will prevent this vomiting happening in the early sickness, that is morning sickness. So this is how you can avoid. I have seen most of the patients nowadays, they are avoiding it because they are eating more frequently.